Doctors, nurses, what are some things you do judge patients for? Non-compliance with medication or treatment regimens in general. Examples: insulin is for F and I'm not going to take it even though I've had type 1 diabetes all my life and frick I'm in coma, someone save me. Yeah, I know I'm in end stage liver failure, but lactulose gives me the runs so I'm just not gonna take it. I'm sure everything will be fine, blah blah, can't stop puking blood, someone save me. My doctor tells me that I have to go to dialysis every other day or I'll drown in my own body fluid since my kidneys don't make pee. Doctors are such freaking idiots. You can tell because they have medical degrees. Frick dialysis. It's stupid, I can't breathe now. Someone save me. Had a patient the other night refuse metformin because I'm not a pill popper. No issues taking Benzasin pain meds though. Not going by my instructions about food or medication and then coming back complaining about how they aren't cured yet or better. I have to take this every day for 7 days. I came here for a cure, not a new hobby. Patient just had a stent placed and his wife enters his room with takeout, greasy cheeseburger, fries and a Diet Coke. PT looks at me, RN, and says this is my 3rd heart attack, nothing new. He was in his 40s. Coming to the for minor things, i.e. splinters, hangnails, pregnancy tests, wow you're a moron, especially if they take an ambulance. Pregnancy tests. This is really concerning for our society. Not the patient in this case, but the patient's entirely neglectful parents, in spite of the imminent death of their child. I gotta give some backstory. When you get a transplant, you have to prove that you're going to take good care of the organ. After all, there aren't many to go around. That means you have to take immunosuppressants, have no pets, since they can cause immune responses that damage the organ, live a healthy lifestyle, in the case of a heart, for example, eating healthily, and just prove in general that you will not do anything that fricks up the organ you get. Anyways, my first time on rounds and I meet a child who is probably 2 years old, his chest hooked up to some machine, and he's just walking around in a hospital crib. He's already pretty heavy, and the chart shows that he's waiting for a heart transplant. After I leave, the chaplain tells me about the kid and his situation. Apparently, he should be getting a heart, but his parents are not doing anything to prove that he will be a worthy recipient of a heart. They keep bringing him fatty fast food because they don't have the discipline to say no to the kid, and they don't ever visit during visiting hours. Parents need to prove that they will be able to handle the higher maintenance of an organ transplant child. These things suck, but they aren't the worst of it. Worst of all, the parents bought a freaking dog. They don't even have any other kids. So that means the parents got a dog for themselves, and as a result they make it impossible for their only child to get a freaking heart. They bought a freaking dog. I mean, what the frick? I wanted to slap the parents, but like I said, they never visit. Worked in oncology research. We'd have patients who'd call and say my naturopath advised me to do this, and then they'd decline treatment, delay treatment, or not take other meds, like things to keep nausea, vomiting at bay, then take herbs, teas, whatever else. Of course a few days or weeks later they'd inevitably call back and wonder why they felt worse. Surprise. Surprise, they are more anemic or their previously much more treatable tumors are much larger. But naturopaths have practiced for thousands of years. It's the basis of modern medicine. Yes, but we took all of those things that kinda worked, refined and tested them, and they became modern medicine. Moron. When babies are born drug dependent because their moms couldn't stop with the morphine, oxycontin and methadone while pregnant. Sure, some have legit pain issues for which they need the meds, but that doesn't comfort a baby going through drug withdrawal. Just to be clear, I judge the mom, not the baby. Not vaccinating their children. This is especially frustrating after addressing all their worries. Hours of explaining peer-reviewed evidence that the vaccine will not harm their child, and sometimes it's a complete waste of time. College educated, High says parents are the worst. They will take the word of the first unqualified person as long as it bolsters their preconceived notions. Meanwhile, a child in a poor country goes without vaccinations and the measles rate in this country peaks. My mind has been blown by the lengths some people take to avoid vaccinating their kids. A guy from our health department told me about a mom who decided to homeschool her kid just to avoid vaccinations. When she realized she couldn't handle it and signed up the kid for public school, she had a meltdown because her son needed, if I recall correctly, 14 vaccinations all at once just to attend. Having cancer and still smoking and won't even take free samples of nicotine patches, etc. Being crazy. I don't mean mentally ill, I mean freaking crazy. After a heart cath, you can die from severe blood loss either outside or inside. Probably your body. You have to clot off the hole in your vein artery the doc's accessed. So, you lay the frick still and don't bend your leg. The buttholes that scream at us for holding pressure on the site and call us incompetent pricks for manually forcing a hematoma out of your crotch don't deserve the care they get. Really, 99% of patients are cool. If you're actually mentally ill, just have someone tell us ahead of time. Those are actually some fun times. Those patients and the crap they say make time go by much quicker. Lying about drug usage, past and present. To turn the tide of this thread a bit, I will interject my opinion. Working in ICU, I sometimes treat patients who are on death's doorstep and I never hear them speak. I never hear their stories. I never get a chance to know them. Once in a while we get patients like this that have a tremendous support system and one that allows dying with dignity and comfort. So, I judge that the patient must have been a tremendous person that touched the lives of everyone in that room and in a vicarious way, touched me as well. Seeing the outpouring of love and support for their dying loved one to me is the truest judgment of character I can imagine. A heart is not measured by how much you love but by how much you are loved by others. Wizard of Oz. I've always hated that line, but I suppose it fits here. We judge them for everything. We just keep it to ourselves. Stereotypes are real. It's no surprise to see the things we do. We joke about it privately. We have to keep sane somehow. I am a nurse and I judge women who don't stop smoking during pregnancy. I also have huge issue with people who smoke in cars with children present. I think that the laws should be super crazy for doing it. A year in jail is a good start. For the record, I smoke. I don't care what you do to yourself. I have problems when you endanger the health of others with your life choices. OMG, I work at the Red Cross and literally across the street is a hospital. The amount of pregnant smoking women out there just depresses the crap out of me. Also, frick all those smokers that leave their cigarettes all over the nice manicured lawn on our property because employees aren't allowed to smoke on theirs. I don't mind the non-compliance. What bothers me are the patients with a tiny bit of medical knowledge that decide to spout it out to me like they've been through med school. I had a patient that told me that she insists I give her the needle suture so that she can stitch herself up, due to her advanced degree in medical assistance. She even insisted she can take her own stitches out and also give herself the tetanus. One time I got a doctor I had never had before because my normal doctor wasn't there. I told her that I was sexually active and she turned into the biggest judgmental bee. Like I couldn't believe she was being so unprofessional. I was of average age and she acted like I was committing murder. Lying. We aren't stupid. We have most of your records available for view. Don't tell me what you did or did not receive the last time you were admitted. People who straight up lie after confirming genital herpes via physical exam, viral culture, and blood work. I can't have herpes. I've never had sex. You don't know what you're talking about. I want a new doctor. Not a doctor. I work in retail. People think I'm a doctor. My doctor said I can't have this medicine anymore. What else do you have? A freaking wall of drugs. Labels all facing you. Read them. I like X from Y store. But you don't have it. Is that the same thing? I don't know. I am not a doctor. I cannot give you medical advice. And you're an idiot that would sue me for that advice anyways. I can't have caffeine. What kind of tea can I get? Decaf has caffeine, but it's decaf. If your doctor says you cannot have caffeine, you cannot under any circumstances purchase tea from this building. It all has caffeine, but it's decaf. The label is not required by law to be completely accurate, and therefore is not completely accurate. I have told you everything I know about the caffeine in our products. Please consult your doctor. I am not a doctor. Can I mix X with alcohol? Under no circumstances will I attempt to answer or influence an answer for that question. Consult your physician. And my personal favorite is extra strength, Tylenol, Advil, Excedrin, the same as store brand How do they compare? At this point I flip the boxes over, show them where they can read the active ingredients label, point out that the pill counts and price are on the labels, and tell them to ask me if they need any other help. 500 mg acetaminophen and this one, 500 mg acetaminophen and that one. Welp, my job is done here. CVS. It was awful. I don't buy 10 different vitamins to take every day. I don't want to answer your questions about them. Treating my staff, nurses, or me badly. I will treat everyone with the same level of professionalism whether you are a prisoner, murderer, non-compliant corpulent diabetic, or whatever. But if you abuse the medical staff, verbal or God forbid physical, I will straight up hate you, and hate myself for having to still provide good care. Not a DR nurse but a medical scribe. I work with an ophthalmologist who also happens to do plastic surgery. Every time a woman who has absolutely no medical need for a surgery but tries to convince that it's a necessity and that insurance should pay for it, they often argue, get rowdy and get upset at the doctor who has no control over the situation. Plastic surgery is fine. Your body do what makes you happy. But a cosmetic procedure is for yourself. You can live without it. Like how you'd pay for a pair of shoes you can live without, you can pay for a new eyelid you can live without. If they have a serious deformity, that's another story. Not exactly patients, but I judge children of old patients that do not take care of their parents. It's heartbreaking to have to ask the old person with multiple comorbidities who should we contact, only to have them reply quietly that their children are no longer in contact. I'm not sure how is it in other parts of the world. I'm guessing the same, but filial piety is a huge part of many Asian cultures and it's hard to watch an abandoned old person with affluent children who do nothing to take care of their parents. When patients nitpick their recommended hospital regimen and then complain that they didn't get the results they wanted. Example, when a patient refuses vital signs every 4 hours because she wants 6-8 hours of uninterrupted sleep, and then accuses the hospital staff of not noticing the fever in its early stages. Well, we would have, if you had just agreed to let us help you, assuming that you've come to the hospital to, get help. Also, I can never understand why patients criticize hospital staff for intervening on a frequent basis after open heart surgery. Yes, a needle in your arm hurts, and yes, we're doing it every day. But you just had your chest and coronaries sliced open and your sternum chopped in half. Why do you assume that your body will heal naturally from what was essentially a fatal physical trauma? Your body will not recover from a quadruple bypass like it recovers from a bout with the flu. Getting 8 hours of uninterrupted sleep after heart surgery is essentially a death sentence. The daily needle in your arm is to measure how much more we need to do to keep death away from you. I'm a nurse. I do my best not to judge. Instead, I try and provide alternative measures and hopefully present the facts to the patient. With that in mind, I hope the tools that I have given them will provide them with motivation and the ability to take care of themselves. I've learned it's best not to judge people, especially patients in the hospital. I barely know them. Some people have literally no control of what's going on in their life due to ignorance or some social issue. I just know their diagnosis and what they currently need help with. I just skim through their social history to get a sense of what they are like. But I do judge people for bringing newborns onto hospital floors that aren't maternity. Just to answer your question, who brings a baby to cesspool of disease? Everything. Way beyond the scope of what I have time to write here. The one that bothers me the most is assuming anyone who isn't well dressed or in a certain demographic is looking for drugs to get high. I've never seen any judgmental balls effect occur, but holy moly is there some crap talking out of earshot. Not quite a doctor or nurse, but an audiologist, so someone who fits hearing aids and deals with deafness. The things I judge patients for are when they say they wear their hearing aid for at least 6 hours per day. Then we connect the hearing aids up to the computer and we can see that it's less than 1 hour. I started telling patients at the point of initially fitting that we can see how many hours they wear it for. At least then they're either honest, or they wear it more. Late to the party but a regular occurrence on our endoscopy unit is people coming in for a gastroscopy who are nil by mouth for the previous 8 hours taking their morning injection of insulin before heading to the unit. They complain of feeling dizzy, so we do a check and find them ridiculously hypoglycemic even though they gave been told not to take their morning insulin. If that wasn't bad enough, They get a new appointment 4 weeks later and do the same dang thing because it has been drummed into them that they must inject their insulin every morning. Not my patients, but their families. When the patient is clearly on their way out, not doing well, and the family is in absolute denial. Don't get me wrong. I understand how shocking and upsetting it must be to realize your big, strong dad can barely stand up without his lungs giving out, or that your mom who's always taken care of you now needs someone to keep her from falling on her face and dying. But do them a favor and let them go. I had a patient one time on a ventilator who couldn't get turned over to be cleaned up without his oxygen saturation tanking, and the daughter was asking us when physical therapy was going to come see him. Another guy needed a machine to pick him up. He couldn't even stand, and was covered in bed sores and had worsening pneumonia, and the family hummed and hawed about signing a DNR for the guy until it was too late and he was rushed to ICU. Please, get these papers in order while you're still healthy and sound of mind, because even though your family may know what you want, when push comes to shove, a lot of people can't stomach being the ones signing their loved one's life away, because they don't realize that everything they loved about that person is pretty much already gone. I love your content #feature me.